I think at diagnosis, leisure is probably used more as a distraction or something just to do, because there's a lot of tests, and so I'll often just meet them briefly when they're sort of getting worked up for treatment and give them different activities that they like, just to keep their mind on something else when they're up to it. So it's probably more about distraction, and then as they get into the routine, if you could call it a routine, but into sort of getting the state of play for the next month or 2 months or however many months, that's when we start to look at goals or modification of leisure. Or, you know, some young people don't have any specific interests because they've been studying full-time uni, working part-time, and then when they've got some spare time they might just go to the pub with mates, so they don't have an actual passive activity. So that's when we might start looking at that. That's often when we'll look at, you know, things like language classes or learning to play the bass guitar or whatever it is during their treatment that they can have of their own. And then into survivorship, I guess sometimes the leisure activities that they've done might lead to new career options or different study options. I've certainly had young people that were studying something completely different prior to their diagnosis and swapped because they got interested in something else, whether it's graphic design or, you know, different things like that. Or I had a young guy who, when he finished his treatment, started a photography course because he got so into photography during his treatment. That was what he loved, so he wanted to study it more. So you might see it used that way, or as a filler during the time that they can't get back to work or study. Or there might be that period of time where they're not going to get to that point. So it might be that time that they're using leisure during that palliative phase, if that makes sense.